This week, we continue our series of interviews to help you keep your student athlete healthy on the court and on the field. You know, injuries are the biggest risk to sidelining your player. So what are the most common injuries? How do you prevent them? And when should an ache or a pain really trigger a call to the doctor? Dr. Kevin Kaplan is here to answer all of those questions. He's an orthopedic surgeon with the Jacksonville Orthopedic Institute, also known as JOI, and he's also the head team physician for the Jacksonville Jaguars. Good morning to you. Thanks for being here. I do appreciate it. It's nice to meet you, doctor.
Thanks for having me.
So what are the most common injuries then for middle and high school students?
Well, when you hear orthopedics, most people think of bones and fractures, and really the most common injuries we see are sprains and strains. So sprains are an injury to a ligament, whereas a strain is an injury to a muscle and a tendon. So whether it's the shoulder or the knee, ligament injuries happen on a regular basis in practice, in games, even during regular training. So.
And are there certain sports that you see most commonly, let's say, knee injuries or lower body injuries?
I'd say across the board, injuries are very similar, whether it's soccer or football or baseball, but there are sport-specific injuries. For instance, an overhand throwing athlete like a pitcher more commonly injures their elbow ligaments. But in football and soccer, you see very commonly knee injuries, ACL injuries or something you see a lot of times, and meniscus cartilage injuries. So a lot of the injuries span across the sports, but there are those specific little nuances of sports where you get more injuries.
And is it common then that, you know, an athlete, because, you know, if you feel like you want to perform for the coach, you want to make the team, that you feel a little tweak in your knee or in your shoulder, for example, and you tend to ignore it, and that causes more harm than good?
I think so. I think kids, you know, especially the younger level, as you get older, the collegiate athletes, even the professional athletes, are more in tune with their bodies and know when to say something to an athletic trainer or when to say something to a physician. But the younger you are, you want to be out there, you want to play. And that is a risk to further injury or injury that could require surgery and have a longer period of time missing games.
So when you have an ache or a pain, what are the signs that, hey, it's time to call a doctor? And should you call, you know, in this case, a pediatrician who then refers you, for example, to an orthopedic specialist?
Well, I think this brings up a good point about where we pick up these injuries. So there's a big movement. The Jacksonville Sports Medicine Program and Bob Sepchek have done a great job in trying to get athletic trainers in our schools. There are schools that don't have athletic trainers, and these kids are at practice, and they may tweak their knee. And they go home, they do their homework, and they try to wake up the next day and then go back out to practice. Having athletic trainers out there is kind of our first line of defense to say, okay, this is an injury, we'll report it to the athletic trainer, and then they can direct them to their either pediatrician or to an orthopedic surgeon, to another outside source. So I think this is one big way to pick up injuries, what you were saying.
Yeah, it's interesting, too, because I know I've been interviewing him specifically about the need to have athletic trainers in every single school. They aren't in every single school. That's going to be our topic tomorrow. In the meantime, is there something that all athletes should be doing either before or even after to help prevent injury?
I think preseason training. The most common time we see injuries is in a transition phase from, say, preseason to regular season. If athletes aren't conditioning their bodies in the preseason, they get into the grind of the regular season and more commonly injure their knees, hamstrings, calves, small injuries like that that can have a big period of missed time. So preconditioning. And then the other thing is overuse. A lot of our athletes, especially in warm weather climates, are participating year-round. And if you're participating year-round and don't give your body a rest, that's another way to get an injury or an overuse type injury.
Ice and heat after workouts?
Ice and heat, regular stretching, and conditioning program is the best way to prevent injuries.
Okay, now I can't have you on the couch and not ask, how's the team looking?
Team looks great.
Game on Sunday good?
Team looks great. We're getting
Everybody's
better,
healthy?
getting better every day.
All right, I love it. Thanks very much, Doctor. Do appreciate having you here. Of course, he was talking about the Jacksonville Jaguars. There was my question. All right, so tomorrow at 8:15, as I mentioned, we continue the conversation about keeping student athletes healthy. Athletic trainers are a key part of safety on the field, as you just heard the two of us talking, and on the court. So the questions you should be asking of these trainers and why all schools really need to have them on staff, we'll get into that tomorrow at 8:15. You know, there's also a free event this weekend where parents can meet with medical experts at the Jacksonville Sports Medicine Program's Injury Prevention Zone. It's going to be set up at Raines High School before the football game on Saturday. It starts at 4 o'clock in the afternoon and runs until 6 o'clock.